Hi everyone, today we are going to talk about nutrition and associated myths in pregnancy. So when we start our pregnancy journey, we always record our weights and we always categorize the BMI, that is body mass index, right? So 19 to 24 is normal BMI. Anybody less than that or above that should have a tailor-made diet, or they should also specifically talk to the nutritionists or the dietitians. So preferably, what is important? When the baby is about 7 weeks, the weight of the baby is hardly 1 gram. When it's about 12 weeks, the weight of the baby is 50 grams. When the baby is about 20 weeks, that's halfway through your pregnancy, baby is about 300 grams. People may have a lot of nausea in the first part of pregnancy. They may lose a lot of weight. They'll be very worried. Am I giving in a good nutrition to the baby or not? Please do not worry too much. Counter your nauseas with nausea helping or elevating medications, or you can even take gummies which will help you to prevent your nausea, and keep eating every 2 hours so that in a small amount so that you don't have the nausea. Coming to how am I going to divide my plate of food? Am I going to have a lot of carbohydrates? Am I going to have a lot of vegetables? Too much of confusion about fruits. Now, I would prefer 25% of your plate should be with carbs, not more than that. But if your BMI is on the lesser side, up to 40% is allowed. And then coming to vegetables, that should be quite considerable amount in your plate. Your potatoes, beetroots, carrots, pumpkins, they all come under starch, or anything that grows below the ground comes under starch. So you need to modify it when you are taking along with carbohydrates. Protein necessity is very important, 1 gram per kg body weight. So in the beginning, you may not be able to tolerate protein too much because of nausea, but later you will slowly get used to eating protein, and everything can be sourced in your kitchen. A lot of protein food is there at home itself. Synthetic protein requirement may not be necessary. You may not need extra protein powders and all that stuff in pregnancy. I always recommend 2 fresh fruits every day. If you are really hungry, you can go to the third one. No Tetra Paks and juices. That is really not helpful in pregnancy. A little handful of dry fruits and nuts. A little bit of fiber, fat is very essential in pregnancy. The most important part is 2 to 3 liters of water. We forget to drink water, and it should be also in periodic intervals. Drinking 1 liter at one time and totally forgetting about it later will not work. Every 2 hours, please go empty your bladder. This is all important in pregnancy. So nutrition is the most important part of pregnancy. Do not blindly go by 15 kgs weight gain, 20 kgs weight gain. No, it is tailor-made for your particular weight. So please talk to your nutritionist before planning pregnancy, and through your pregnancy also you can talk to your doctor and the nutritionist. There are certain questions that come to me. Can I have a cup of coffee? Can I have a cup of tea? Yes, a cup of coffee and a cup of tea are allowed, not more than that. Please do not keep indulging in these coffees and teas too much. It is not healthy. And no fizzy drinks in pregnancy, no sugary drinks or carbonated drinks in pregnancy, no alcohol, no smoking, and no medication without your doctor's help. Pineapple, papaya, can I eat anything which is dark colored? Basically, I tell my patients everything is safe in pregnancy. These are all just myths. But please remember, people at home, your parents, everybody is very stressed out about pregnancy. They all want to be healthy. They want to tell you to eat healthy. They're very worried about certain things. So I always tell the first trimester women, please talk to your parents, decide what you want to eat. There's no hurry, no need to challenge people that no, I ate pineapple, nothing happened. I ate papaya, nothing happened. If you do not like the fruit, please don't have to challenge anybody. Eat what you like. That's the most important thing in pregnancy. Eat what you like. Try avoiding sweets, try avoiding carbonated drinks, try avoiding coffee and tea too much, no alcohol and no smoking. Thank you.